gotcha. Hi, everyone. Is this working? Can you hear me okay? All right, good. Sometimes I walk around and carry stuff, so if I start walking around, don't be, oh, there we go, too alarmed. First, I'd like to introduce you to my lovely assistant. This is Miss Katie Dunlap, my daughter. I figured one thing to just make the talk more dynamic would be if I had little giveaways that go along with the talk. So she's going to be running back and forth, doing cartwheels and passing out goodies at the same time. Maybe not the cartwheels. So I was asked to kind of talk about survivorship. And was there a clicker up here too? I seem to have misplaced.
You have to tell us, I'll have to do it for you. Don, do you have a clicker?
Or is this a clicker?
Yes.
Oh, I'll give it a shot here. Okay, punch a button here. Oh, there we go. Okay, so you finished treatment. You got to ring the bell. Now what? This is something that a lot of folks have struggled with, because here you're seeing the cancer team weekly sometimes, and you're plugged in, you're doing everything right, and then all of a sudden you ring the bell and we say, we'll see you in 3 months, and that is a very terrifying feeling to just suddenly be turned loose. So I thought what I could do today is kind of talk about some of the things that you can do to continue to be proactive with your cancer care and management. So next, and I'll walk a little bit closer to see my slides here. My eyes aren't the best. What I've got there is just kind of what I wanted to break things down into: nutrition and exercise, of course, which Claire covered brilliantly. So I was sitting there looking at my own notes. It was very similar to what she was going to be saying. And then also, let's see here. Boy, I cannot, let me use my other little sheet here. I'll tell you, my eyes aren't too good here. Thank you. Side effects from low estrogen, also very critical, especially for women that are on the hormone deprivation or endocrine medications. And then lymphedema, something I was visiting with some other people about today, that has been a very difficult thing that women have to go through. And then also depression and anxiety, something that I want to definitely touch on, because that's a huge thing that women go through when they have gotten through everything. Next slide here. Let me flip my little page here. We'll start with nutrition and exercise, and I think Claire beautifully touched on all of these type of things, so I won't spend too much time on it because she nailed it. I think one thing just to be of note, having a BMI of 30 at the time of diagnosis, it does cause an increased risk of breast cancer recurrence. So anything you can do after treatment to kind of get into the best shape possible is going to be a bonus in helping you stay cancer-free and also just have good health in general. There's several things to do to focus on weight loss, dietary changes, activity, and then I wanted to touch on the GLP-1 medications that are making so much news lately. So let me go to the next slide. Best type of diet you can go with, what the NCCN or the National Comprehensive Cancer Network says, is a Mediterranean diet. And just like the picture shows, it's talking about having a plant-based diet. Red meat is not something you have to eliminate, but less than 18 ounces a week is ideal. Emphasize fish, poultry, things like that. Probably 5 to 7 fruits and vegetables a day, and definitely whole grains. Now, one of the things Claire mentioned, which I was so glad she mentioned, was that sugar is not your enemy. You know, that is a myth. I have so many people talk to me about, no, don't eat any sugar because it makes cancer grow. Well, here's the thing. Yes, cancer uses sugar, but so do the rest of your cells. And technically, before you can starve cancer of sugar, you would have to take your blood glucose to 0, and long before you got to 0, your heart, your brain, your kidneys would shut down. So really, what the American Cancer Society and the NCCN recommend is moderation in sugar. So consuming, let me see, what did it say? Less than 25 grams of sugar a day. That's about 6 teaspoons of sugar. That's really ideal. And then here's the hard one, especially for me, is limiting yourself to 1 sweet beverage a week at most. That's a hard one. So anyway, but that's something that I'm working towards as well. Because the Mediterranean diet is so important and eating whole foods instead of processed foods, I do have a gift card here that my lovely assistant's going to give out to Whole Foods. It's one of the gold boxes. Okay. Yeah, that's it. All right, charge forth, little one. All right, so this will just, if anyone is needing a jump start on eating whole foods, this is a gift card to Whole Foods for you. Let's see, next slide here. Okay, vitamins and supplements. Here's something also, there's a lot of myths about this of what to take and what not to take. What I can tell you is that there actually are no randomized controlled trials that say you need to take a specific vitamin to keep cancer from coming back. Now, there's some observational information out there, specifically with vitamin D, which I think is very fascinating. In fact, with vitamin D, they're indicating that patients that have a normal amount of vitamin D, as compared to patients that are vitamin D deficient, have better overall survival and disease-free survival. To date, there are 2 randomized clinical trials with vitamin D in which they found women that had to get chemotherapy first, followed by the breast surgery, that the ones that were vitamin D sufficient actually had better overall response to the chemotherapy and just did better. So vitamin D is something I highly recommend, not just for cancer, but also for bone strength, immune strength, so many things like that. Now, I will say when it comes to taking vitamins during chemotherapy or during radiation, wouldn't recommend that. A lot of people feel like, oh gosh, I need to take vitamins during treatment because it's going to help. Actually, the thing that happens is chemotherapy and radiation, the way they work is they form free radicals to try to destroy the cancer. And it just so happens the vitamins I've mentioned up there, vitamins A, C, E, CoQ10, one of the ways these work is they stop free radicals. So in essence, they're counteracting the therapy. So as I said, I'm certainly not opposed to vitamins after treatment and trying different things, but I wouldn't be taking them during treatment. And again, really the only thing the NCCN recommends at most is taking a multivitamin, but at the same time, like Claire was talking about, if you eat a wide variety of foods, you're going to get all your nutrients from that. So technically, you don't have to take vitamins. At the same time, I do have some vitamin D that my assistant would like to pass out here. Got that? Yes. All right. And let's see here. Let me go on to the next slide here. Oh, good. There we go. Okay. So exercise, can't stress enough how important that is. And it's interesting, when I was reviewing this information, I found out that really during treatment, the #1 exercise that people do is yoga. So the thing I like about yoga is that it's low impact. It's not going to cause problems to your joints. It's going to help you feel better. It helps loosening muscles up and helps with flexibility and also mental state. So yoga is just absolutely a wonderful thing to do during treatment. Now, if you're already running 10Ks while you're on treatment, I'm not going to stop you from doing that. But if you're not exercising at all, something that might be good to try is yoga. Now, for the folks that are done with treatment, it actually recommends more vigorous exercise, aerobic activity, getting your heart rate up about 2.5 hours a week. And heaven knows when you do that, you're going to need lots and lots of waters. So plenty of water is definitely something that's going to make you feel better, and it's going to help when you're doing your exercise journey. So definitely recommend that. Let's see here. What was the next thing? So water important. Also just some key things. Statistics regarding exercise say that there's about a 37% lower risk of breast cancer mortality for those that exercise. And then there's a 42% lower risk of all causes of mortality when comparing to people that are active versus inactive. So the benefits of exercise, I can't stress that enough of how important that's going to be. So benefits, weight management. You know, most of the breast cancer we see are people that are hormone receptor positive, and the postmenopausal women are on aromatase inhibitors like Arimidex, Femera, Aromasin. And as you know, many of those can cause significant joint pain. That can be very debilitating. So exercise, yoga, things like that can make a phenomenal difference in the discomfort that comes from taking the aromatase inhibitors. So the next slide, let's see if I get to the next one. Did it go? Oh, whoops, it did a little water thing there. There we go. I forgot to do that part. So the GLP-1 receptor agonist after cancer, I would say, first and foremost, I wouldn't do this during treatment because you need to maintain your strength while you're getting chemotherapy and radiation. Afterwards, in your work towards getting to a healthy weight, I'd first recommend exercise and diet modification, but the GLP-1s, they are an option. And it's interesting, there are articles now coming out in some of the major cancer journals. JAMA, for one, in 2026, said that the GLP-1s are underutilized and could be really, really beneficial to cancer patients. Only about 1% of cancer patients are getting these. And what I'd also say about it, most importantly, is the GLP-1s are not going to increase your risk of cancer coming back. So I've had people ask me that. They've wanted to try them. They're afraid to. Everything I've read about it, if you would like to try that under supervision of a doctor and a nutritionist, it would be safe to do that. Albeit, of note, women that are on the endocrine deprivation therapy, they don't lose as much weight as someone who's not on that therapy because, as you know, the endocrine deprivation therapy itself can contribute to weight gain. So that's something to just keep in mind. Next slide, side effects from estrogen suppression. So the big ones that I think about are hot flashes, vaginal atrophy and dryness, bone loss. Those are the big ones. And, oh, there we go. So hot flashes, there are actually some things that can be taken to help with that. So, of course, we avoid any type of hormone replacement therapy because that would be counterproductive. But there are other medicines that are safe to utilize. One, antidepressants, there are a couple of them that are highly known to block hot flashes. So that's a reasonable thing. There's also anticonvulsants, specifically gabapentin or Neurontin, that can help with hot flashes. It does have additional side effects that could be problematic, so it's not one of my go-tos when I'm trying to help with hot flashes for patients. Veoza, I have started prescribing this to several women, and this seems to be very beneficial and is safe to use in women that are on the endocrine therapy or the hormone deprivation therapy. And then, of course, oxybutynin is another one. Now, other things that have been proven not to be helpful are vitamin E, magnesium, black cohosh, and soy. But just know that if you are experiencing hot flashes and you're thinking, oh my gosh, I can't do this endocrine therapy anymore, just know that there are some things you can take that might be beneficial and help you to stay on the endocrine therapy. Let's see here. There we go. Next, vaginal atrophy and dryness. This is definitely a problem. It's a huge quality of life issue. It can affect your marriage, your social interactions. It can just have such a huge impact. I reviewed all the literature for this before I wanted to visit with you all, and I also talked to several of the gynecology oncologists at our office to make sure I had everything straight. What I can tell you is, first, options would be to try a non-hormonal medication or water-based lubricants, silicone, vitamin E and D suppositories. Those are options, but here's the kicker. A lot of people have been very afraid of using a vaginal estrogen for fear, is this going to be absorbed and can this make the cancer grow? And the good news is they have done several studies now not just a few. I think I counted up 7 studies in which they found that it did not increase the risk of breast cancer coming back if you used a topical estrogen cream to help with vaginal atrophy. So just know this is something you can talk to your doctor about. It is safe to use. It's recommended using low dose, which is like 0.01% twice a week. But this can make a huge difference in intimacy. So that was the main one there. And I think you probably can mention the trials at the bottom there. I can't read it from here, but you probably can see them. Next slide, bone loss from aromatase inhibitors. This is something that definitely happens. Estrogen suppression is going to lead to accelerated bone loss. People that are on aromatase inhibitors, there's an increased risk of fraction, 40% compared to those that are just on tamoxifen. So what I always do in clinic is I first get a baseline bone density on patients, and then I get one every 2 years while they're on an aromatase inhibitor. I also recommend taking vitamin D. Our goal is for your vitamin D level to be between 30 and 100. If it's less than 30, then we usually do high dose vitamin D temporarily. If it's already between 30 and 100, then we can go ahead and use regular daily amounts, which is anywhere from 600 to 1,000 IU daily. Calcium. Obviously, you don't want to just take the vitamin D. The calcium is going to help in supporting your bone skeletal system. Weight-bearing exercise is also proven to be beneficial. Smoking cessation, limiting alcohol intake as well. Of course, there's also some medications that can help with bone loss, specifically bisphosphonates such as Fosamax or Boniva. You've probably also heard of the injection form, Prolia. All of those can help with bone loss. What I do recommend is if you are going to try one of those medications, make sure you see your dentist beforehand, because there is a risk of jaw injury from these medications. It's rare, but it's important to make sure all dental issues are taken care of before trying a bisphosphonate or Prolia. Okay, how many more goodies do we have left? Oh, just the journals. Okay. Yes, okay. So next slide, lymphedema. And this is a topic that just is kind of brushed over oftentimes, and it can be a huge factor. What I recommend on this and what's reported is to get pre-op baseline measurements of both arms, because unfortunately, if you wait till after the lumpectomy and lymph node dissection, 50% of the time the diagnosis is missed. And really the key to catching lymphedema and treating it before it becomes problematic is treating it early. And to treat it while it's minimal. The first phase, what's recommended is seeing a lymphedema specialist who can work with specifically the manual lymphatic drainage, which is a hands-on massage technique, and it's going to help encourage lymphatic flow. There's also compression therapy. Initially, they might be using just different bandages to compress the arm and help move the fluid back up into your system. But eventually, once that is down, having a lymphedema sleeve is extremely helpful. Skin and nail care, also very critical in maintaining function of the arm and protecting you from getting an infection. And the next slide, just to continue on lymphedema, some of the things I always tell women that are at risk for lymphedema is to be on guard for any signs of infection, because lymphedema will put you at risk for infection. So infection signs would be warmth, pain, streaking, redness of the arm. Any of those type of things would be a sign of a cellulitis occurring, and you would want to speak to your doctor. You would more than likely need antibiotics. So that's something to be on guard for. Now, some myths about lymphedema are that you can't travel by air, or heaven forbid someone tries to draw blood from an arm that has a history of lymphedema or blood pressure. These are myths that can be done in that arm. However, when in doubt, just go ahead and use your other arm first, but know that if necessary, you can use the arm that has lymphedema for those things. The other myth that I share with people is that you can actually do significant exercises with the arm that has lymphedema, and it'll actually improve it. Now, of course, I'd recommend doing it with the guidance of a lymphedema specialist, as well as having an exercise coach to guide you on that. But I don't want you to think you have to limit yourself in exercise just because there might be lymphedema present. And let's see here. Next slide. This one's one of my favorite slides. I'll pause for a second and let you guys read this. I actually found this on Amazon, and I changed it. It said life, not cancer, but I changed it to fit this because it just spoke to me, and I have it hanging in my office, and it speaks to breast cancer patients and the physical trauma that they go through with surgery and radiation and chemotherapy. But you know what? The more and more I talk to women, the more I see that the scars you can't see are the ones that are affecting women the most. You know, something that really hit home with me was when I visit with patients, they were so strong through treatment, they didn't cry one bit, they were tough, they went through it, and then afterwards, that's when the tears came. And I finally have a theory on that. It's that when you find out you have cancer, you're in fight mode. There's no time to be afraid. You have to be brave. You have to fight. There's no time for tears. And then when it's over with, all of a sudden you realize what you've gone through. You realize you walked through fire. And you start weeping because it's as if you lose a piece of your innocence, that piece that told you, that innocence that told you if you did everything right, if you ate well, if you exercised, if you got your mammogram, if you did this and that, this wouldn't happen to you. And then you find out, no, this can happen to anyone. And it takes a piece of your innocence away. And now what you're facing is a new normal. And nothing is the same. And that's when the tears come from this. So I have a few suggestions of things that might help. First, to recognize that depression is real, and it happens to cancer patients. And then PTSD is real. It doesn't just happen to people that are in a war zone. It happens to cancer patients. With the depression, 30 to 40% of breast cancer survivors have depression. For that matter, close to 15% have depression even 4 and 5 years out from cancer diagnosis. Risk factors include having an advanced stage, having to go through a very aggressive treatment like chemo, having endocrine therapy, which certainly changes your emotions, that can do it too. And then also just fear of it coming back. That's going to lay a heavy load on you and cause depression. Unrelieved chronic pain, physical dysfunction, physical changes, all of these things are going to contribute to depression. The PTSD, I looked through things to try to get an idea of how much was there. It's a wide range. The highest range I saw was it could be up to 72% of people having post-traumatic stress disorder. I've had some patients that after they're done with treatment, their heart races when they try to even come into our office because they're reliving the trauma. I think some of the things that would help the most are obviously getting into counseling, cognitive behavioral therapy, whether it's individual or with a group. It is phenomenal, and it can change the course of your life if you take that first step to get involved with that. Mindfulness-based cancer therapy or recovery is also something important. Meditation, journaling, which I find sometimes if you can't say it out loud what's going on, you can write it down in a journal, and you can get your feelings out onto paper, and that can make a phenomenal difference. Other things, yoga, of course, again, although we're out of yoga mats, yoga, obviously a good thing. Group discussions, being around cancer survivors, those can help. Of course, medications are things that can help. I recommend the other things first, but by all means, take every action possible to help yourself overcome what you've endured. There's also issues with body issues. And, you know, there are programs called, I wrote some of them down, appearance care programs like Look Good, Feel Better, Recover Your Smile, Health in the Mirror. So much of that just recovering you psychologically. And our last gift card is to Ulta. So it's not much, but see the OU hat back there, Katie? They've been waving for some, way back there, Katie. Go back there, give it to the nice lady with the OU hat. That can be a phenomenal thing to help in recovery. And I think just most importantly is to not isolate yourself, surround yourself with friends, family, church members, neighbors, anyone, because trying to go it alone, that's not the way to recover from this in survivorship. And anyway, thank you for your time. I appreciate it.